And we now speak to Private Hospitals Association of the Philippines President, Dr. Jose De Grano. Good morning, Doctor. Thank you for joining us.
Hi, good morning, Ria.
Doctor, can you tell us, by what you can see and what you know, how are private hospitals doing now amid this surge in cases?
Well, if you will notice, the numbers are really plateauing. It has not changed so much compared to last week. Well, maybe because it's just an offshoot of the last 2 weeks figures. But if you talk to the different hospitals, you will see that there is somewhat an easing up of the areas like the emergency room where the queue or the lining up of the waitlisted patients have dramatically reduced.
All right, that is definitely good news, no, Doctor. Now we are on the third day, I believe, of a more relaxed MECQ. So, do you think that it was wise that we ease quarantine restrictions, even though cases are not yet going down? They are at the very least plateauing, but they're not going down.
Well, I think we have done that. This is still good. At least it has more or less restricted the movement of some people, and well, it also helps the economy. So actually, that's the balancing act of the economy and the health concerns. And I think we'll see in the next 2 weeks if this really works, and hopefully it does. What we want to know is, and what we want to see is for the people to observe still the minimum health protocols, and for the local government units to implement these minimum health protocols.
Right. That, of course, is one aspect of controlling the pandemic. Another is testing. And we had Health Secretary Francisco Duque say that every 2 weeks, healthcare workers are getting tested. But we also heard from a nurses group saying that is not actually true. By your observation and the data that you have, Dr. De Grano, are health workers getting tested every 2 weeks as they should be?
Well, that is embodied actually in a department memorandum. I think it's a series of 2020-0546, where the healthcare workers are supposed to have tests every 2 weeks. But remember, is it really practical to do that? If you have, let's say, in a 100-bed hospital, you have 400 healthcare workers. If you subject them to RT-PCR every 2 weeks, how much would it cost the hospital? That's 400 times 4,000 for RT-PCR. That's 1.6 million every 2 weeks. And it will be around 3.2 million every month. Where will you get the money to pay for those things?
Right. Okay. That being the case, Doctor, what would be the solution here? We understand that it is very expensive. There's no doubt about that. But what can we do to ensure the safety of healthcare workers, because they are so essential in this battle against the virus?
What's happening right now is those that are really directly in contact with COVID patients, they are the ones who are being given the test more or less every 2 weeks, given the rest for another 2 weeks. And in case they take a rest and they leave the hospital, before they even start going back to their work, they are also given the test. But not all the healthcare workers of the hospital are given the test every 2 weeks.
All right. So it's just the direct contact healthcare workers.
Yeah.
Dr. De Grano, thank you so much for your time this morning. We appreciate your thoughts and your expertise. That was PHAPI President, Dr. Jose De Grano.